both tonsils. Try and keep it quite dry, so don't suck it up, don't let it go anywhere near your tongue. Try and get to the tonsils.
The test kit looks the same.
Up about 2.5 centimetres to an inch.
But this is fast turnaround.
Make sure you're bringing that fluid right up over the swab.
Results on the spot, in this case, at a fire station in Burnley this morning.
It was a little bit funny on the throat, but the nose was a bit, make your eyes water. Sorry, we've got to respond to an incident.
Oh, okay,
sorry.
Yeah. This kind of testing, we were told today, will give us more freedom.
Let us follow the guidance. Let us roll out mass testing. Let's work to deliver mass testing to the people of our country.
And even Christmas with loved ones, without the worry of what if.
I would urge people who are worried that they may need to be in company of those who are elderly or vulnerable to seek to get a rapid turnaround test.
Only what the Prime Minister said today doesn't match what it says in the government's community testing guide, published last night. It says some places in Tier 3 might not get a mass testing programme until after Christmas, and that the rollout won't be the same as the pilot in Liverpool, where the offer was get one if you want, and hundreds of thousands did. It may well be more like what they're already doing in Lancashire, where firefighters are part of a limited-scale rapid testing trial.
We do have COVID measures in place on the stations to ensure that we keep the social distancing.
But that's really hard on a fire engine, isn't it?
Ultimately, once we get onto a fire appliance, the social distancing is vastly reduced. So by being able to do the mass testing or the testing of crews prior to commencement of shift, it's obviously going to give us a bigger opportunity to ensure that we don't put people together who may be infected.
Those who'll wake up in Tier 3 tomorrow have been told there is a way out. Liverpool's the example. Mass testing is how. But Lancashire's Director of Public Health, while welcoming more testing availability, knows the reality that there won't be the same backup from the military or the same number of tests available. Do you have an idea of what kind of numbers you could be looking at in Lancashire?
Yeah, what we want to do is smart testing with our communities, and we want everyone who is being asked to come and get tested, please do come and get tested. But it is likely to be in the thousands before we reach tens of thousands.
And with concerns about a higher rate of false negatives, for now, in this area, he says results from lateral flow tests won't be used to allow care home visits.
But when it comes to high-risk situations, we are taking a very careful approach so that we don't do more harm than good.
Most see more testing as part of the solution, but not in isolation. And perhaps the moonshot promise was always too simple.